everyone, in this video you will learn about flap CPT codes. In the last video you have learned about the skin substitute graft CPT codes. So we will go with the flap CPT codes. To code a flap CPT codes you have to know the definition of the flap and the types of flaps and the procedure involved in the flap coding. Okay, so what is a flap? So flap, the physician here is taking a tissue. So the tissue can be a skin or a muscle or a fascia. So what he is doing here in flap, he's whatever the flap he is taking, he is moving from one side to the another side. Okay, here the blood supply is present. Okay, blood supply is present in the flap. Whereas in the graft, there is no blood supply. Okay, that is the flap. So what the physician will do? He is taking a tissue along with the blood supply and moving from one side to the another area. Okay, that is the flap. Next, we have a pedicle flap. So pedicle flap, here the flap remains attached to the original blood vessels. Okay, so whenever flap is attached to the original blood vessel during the transfer to the another side, you can consider it as a pedicle flap. Next, we have a tubed pedicle flap. So what is a tubed pedicle flap? Here the physician is suturing the edges of the flap, pedicle flap, to form a tube. So that tube will protect the blood supply during the transfer. Okay, that is a tubed pedicle flap. Okay, we have flap, pedicle flap and tubed pedicle flap. Next important things are the donor site and the recipient site. So in flap coding, you need to know the donor site and the recipient site. So donor site will be your original location. Okay, original location where the physician is going to take the flap. So that is the donor site. Next we have the recipient site. So the defect area where the flap is placed, that is the recipient site. So the defect site will be your recipient site. Okay. Next we have the stages of the pedicle flap. Okay. So we have stages. So first stage is the transfer stage. Okay, we have CPT 155702 to 15576. So here the creation and the transfer of the flap to the defect. Okay, so here the physician is creating the flap, okay, and transferring the flap to the defect. So here blood supply will be present. So this is the transfer stage where the physician is creating and transferring of the flap to the defect side. Okay, this is a transfer stage. Next we have a stage 2. Okay, so we have stage 2 where the division and insert. Okay, so after the healing, the physician is dividing the flap. Okay, dividing the flap from the pedicle. Okay, he is dividing the flap from the pedicle and return to the donor side. Okay, that is the stage 2 we have. Next we have the walking flap. So here flap is moved step by step across the body in multiple stages. That is the walking flap. These are the stages we have. So here the flap is moved step by step across the body. Next we have special flaps, mid-phase flap. Okay, we have CPT 15730. In mid-phase flap, what the physician will do? Here a pedicle flap he is taking. Okay, he is taking the pedicle flap and he use it in a mid-phase reconstruction. Okay, using it in a mid-phase reconstruction and preserving the facial blood vessels and the nerves. Okay, that is the pedicle flap. Next we have the paramedian forehead flap. Next we have two-stage flap. Next we have a two-stage flap from the forehead. So they are taking the flap from the forehead and they are using mainly for the nasal reconstruction. Okay, so these are based on the supratrochlear artery. Okay, that is the paramedian forehead flap. Okay, we have CPT 15731. Next we have the flap types by the tissue. So we have muscle flap. So a flap, it is made of muscle tissue. Okay, then we have a myocutaneous flap. So here the flap containing the muscle and the skin. Then we have the fasciocutaneous flap. So here the flap contains fascia along with the skin. You can consider it as a fasciocutaneous flap. Next we have the vascular pedicle. So what happens in vascular pedicle? The artery and the vein supplying the blood to the flap. So that is the vascular pedicle. So artery and vein combined together, supplying a blood to the flap. Next, we have the flap viability. So here the physician will do assessment whether the flap has the adequate blood supply or not. So, and a survival potential he will check. That is the flap viability. Next, we have the undermining. So what the physician will do in undermining? Okay. Next, undermining. So here they are separating the tissue layers to mobilize the flap without damaging the blood supply. So next we have a rotation or advancement. In rotation, they are turning the defect. In advancement, they are moving forward. So these are the movements of the flap. Next we have the inset. Final placement and suturing of the flap into the defect site is called inset. Next, hemostasis. Whenever there is a surgery, when the bleeding occurs, the physician will do hemostasis, means control of bleeding he will do. Okay, we will use it as the term hemostasis. Next, we have subperiosteal plane. So here the dissection layer below the periosteum. Okay, bone covering. Some coding important terms you need to know. Primary closure, here closing wounds directly with the sutures. Okay, that is the primary closure. Next we have a split thickness skin graft. Okay, what happens in split thickness skin graft? Epidermis and part of the dermis is involved. Okay, in separate procedure a service can be coded separately if it is performed independently only. So if it is the only procedure you can code, or else you will not code the separate procedure. Medical necessity should be there to code with the other procedure. Okay. Next we have the guidelines related to the flap procedure. Okay. First you have to identify the flap procedure, whether the skin and deep tissue flap. Next you have to determine the coding. Okay. Most flaps you will code by the recipient side. Okay. Exception is for the 15733 and 2738 you will code to the donor side. Next, you have to check if tubed pedicle or a flap delay performed. So whenever the physician is performing a delay flap or a tubed pedicle, you will code based on the donor side, not on the recipient side. So mostly flaps you will code for the recipient side. Okay. But for the delayed flap and the tubed pedicle, you will code for the donor side. If any cast or a device, if they are performing, you will code it separately. Next, you have to evaluate the donor site repair. If they are doing the donor site repair, any skin graft or a local flap, you can code it separately. Next, you have to check the flap type. Okay. If it is a microvascular flap, you can code the CPT codes 7562, 758. Next, if it is a pedicle flap without vascular inclusion, you can code 5702, 576. Then you have to finalize the correct CPT. So next we have a pedicle flap CPT. CPT codes 155702 576. So first you have to identify the procedure, whether a pedicle flap is created or not. Okay, whether the tissue remain attached to the blood supply. If it is blood supply is not there and the pedicle flap is not there, then you will not code CPT 5702 576. Okay, if blood supply is there and the pedicle flap is created, then only you will code the CPT codes of the pedicle flap. So flap, if it is created from the donor side here. So if the flap here is creating from the donor side with the blood supply, okay, then the flap you have to check whether it is a direct flap or a tubed pedicle flap. Okay. So if it is flap transferred to the recipient defect, okay. So here the flap they are transferring it to the recipient side and suturing the flap in the layers, okay. Next the donor side is closed, okay. If they are applying any skin graft, you can code it separately, okay. Next we have a second stage. Later pedicle is divided and returned to the original site, okay. That is the second stage. So you will code the CPTs based on the donor side. So we have CPTs 570 for trunk, 572 is for the scalp, arms, legs. 574 for the face area, forehead, cheek, neck, etc. And 576 is for the eyelids, nose, ears, lips, and intraoral. Next, we have the pedicle flap stage 2. So, here the like patient with the previous pedicle flap. So, primary procedure is done, and then now he is for the second stage. Okay, first stage already done, and he is coming for the second stage, that too for the pedicle flap division. So, after healing, you need to check. If it is not, then you will not use. Only after the healing, you will use this second stage procedures. Okay, pedicle flap stage 2 procedures you will use only after the healing of the healing. So we have pedicle flap here. They are dividing it. Any unused portion of the flap, they are detaching, and the flap is returned to the donor site. Okay, flap returned to the original donor site and the flap sutured in layers. Okay, donor site is managed by primary closure or skin graft if needed. So we have, based on the donor site, we have for CPT codes from 600, 610, 612 and 630. So based on the anatomical location, you can code this set of CPT codes. Next, we have a walking flap. So, previously placed pedicle flap, if it is present or not, first you need to check, then only you will code the flap. If not, you will not use the flap, walking flap. So, walking flap will move from one body to the from across the body in stages, right? So, here flap is developed good blood supply from the recipient side. Okay, so flap is released from original donor side and the flap is moved completely to the new location. So here the flap moved again by later walking process. It is like walking process. So the name walking flap. Okay. Next we have a mid-phase flap. So here you need to identify the mid-phase defect which needs the reconstruction in the mid-phase flap. Okay. So first you have to identify the mid-phase defect. Okay. Next you have to select the flap site based on the vascular pedicle. And then you have to mark the area. Okay. Mark the area and you have to confirm the blood supply and identify the nerves. Okay. Next you have to dissect the flap. Okay. And then you have to preserve the pedicle. Okay. Avoid twisting or kinking and adjust the flap thickness as per the defect. Then you have to check the flap viability and advance the flap to the defect site. Here they are moving. Okay, secure the flap with the sutures and close in layers. That is the mid-phase flap. Okay. Next we have the forehead flap. So what is forehead flap? So here nasal defect which needs the reconstruction. He is taking the flap from the forehead. Okay. So same thing, he will create a template of the defect and measure the pedicle length. Okay, they will mark an artery using the Doppler, administer anesthesia, incise the forehead skin and the subcutaneous tissue, and undermine the flap, preserve the blood supply, prevent twisting of the pedicle, and mobilize and thin the flap. And they will check for the viability, transfer the flap to the nose. Okay, nasal reconstruction. Okay, and secure with the sutures. So, and they will close the donor side. Then we have the flap repair. So, wherever the defect area, they will identify which needs to the reconstruction. Okay, so we have types of flaps: muzzle flap, myocutaneous, and fasciocutaneous. So they will harvest the flap from the donor side with the vascular pedicle. Okay, they will preserve the blood supply and transfer to the defect side. Okay, position the flap properly. Okay, and they will suture the flap in the place, and then they will close the donor side. So the donor side which needs the skin graft or a flap can be coded separately. Okay, so we have CPT code based on the Location for head and neck, you will code 15733 and 15734 is for the trunk, and 736 for the upper extremity, and 738 is for the lower extremity. Hope you understood the flap CPT procedure. Hope you understood the flap CPT codes. See you in the next integumentary system video. If you like the video, please subscribe and share. If you are interested in surgery medical coding, you can contact me through the mail, which I will be sharing in the description. Thank you. See you in the next integumentary video.